Imagine a healthy 80-year-old senior. They go for a routine medical screening. The test seems harmless. They have no current symptoms. A small spot is detected. This leads to an invasive biopsy. Complications immediately arise. They suffer severe bleeding. A massive infection occurs. A cascade of medical interventions begins. The person's health rapidly declines. They never fully recover their strength. This exact scenario happens daily. Standard medical screenings can prove fatal. This applies specifically to seniors. You must understand the data. We prioritize clinical truth. We ignore generalized healthcare dogma. We analyze raw, peer-reviewed evidence. Subscribe to this channel today. Join our biological truth community. Protect your organ systems. Subscribe now for essential data. Let us use an analogy. Consider your local airport. Excessive security is problematic. It causes massive delays. It triggers unnecessary panic. It forces intrusive pat-downs. It drains passenger energy. Your immune system is like this. Screening is the metal detector. It finds harmless coins. It misses non-metallic dangers. It creates false alarms. It causes intrusive follow-up. Modern medicine loves testing. Screening creates false security. It triggers massive overdiagnosis. Overdiagnosis is a lethal trap. It identifies slow-growing tissues. These tissues are not aggressive. They would never cause symptoms. Yet we aggressively treat them. Overtreatment is physically devastating. It involves harsh pharmaceuticals. It requires invasive surgeries. These procedures carry inherent risks. Risks increase with advanced age. Seniors cannot recover easily. We will examine the top 5. The first screening is PSA testing. This tests for prostate cancer. PSA tests have huge failure rates. They generate high false positives. They find indolent cancers. Doctors aggressively remove the prostate. This causes severe side effects. Seniors risk permanent urinary incontinence. They risk total sexual dysfunction. The clinical data supports individual decision-making. PSA testing should stop over 70. The second screening is mammography. This targets breast cancer in very old age. Many senior breast cancers grow very slowly. They would never harm the patient, but we find them and radiate them. We perform disfiguring surgeries. Overtreatment induces profound anxiety. Clinical protocols recommend stopping screening. The American Cancer Society supports this. Stop when life expectancy is under 10 years. The third dangerous screening is colonoscopy. We mean screening in the very old. USPSTF advises against screening after 85. Perforation risk increases dramatically. Severe bleeding risks rise significantly. Preparation causes dangerous dehydration. It triggers immediate electrolyte imbalances. These can cause heart failure. They can trigger acute strokes. Seniors do not need this risk. The fourth killer screening is whole-body CT scans. These are heavily marketed. Hospitals sell them as preventive. They are advanced profit centers. The radiation dose is astronomical. This radiation induces cancers later. It specifically mutates senior stem cells. More dangerously, they find incidentalomas. These are medically irrelevant spots. Harmless cysts appear scary. This leads to aggressive follow-up. It triggers unnecessary invasive biopsies. Biopsies carry risk of death. The fifth danger is cervical cancer screening, specifically Pap smears in seniors. The risk drops after 65. Previous negative screens are key. Overtreatment involves invasive LEEP procedures. It involves senior cone biopsies. This causes significant pain. It triggers localized organ infections. Senior guidelines strongly advise stopping. You need a protocol change. You must shift your mindset. Prioritize symptoms over screenings. Trust your own biological feedback. You are the biological manager. Discuss this data with your physician. Demand absolute clinical justification. Show them the specific guidelines. Challenge the universal testing dogma. Never accept standard testing without thought. Prioritize your active life quality. Protect your vulnerable tissues. Monitor your symptoms actively. We will continue clinical analysis. Protect your cellular longevity. Stay perfectly objective, always. Thank you for seeking truth today. Consult your gastroenterologist immediately. Inform your primary care physician now.